All right, I might have to jump off to charge my phone and make another call, but I'll jump back on a little later.
Oh yeah, or
Chippy,
we'll see you
thank
next week too,
you.
man. You're gonna be the star of the show next week, buddy. Hopefully, get closer to 500. That would be the high watermark for any of my webinars.
I'm working on it, brother. I'm pushing it out again.
That's amazing.
Well, Cargill's pushing it out. Once Cargill starts pushing it out, I'm sure we're gonna get a lot of folks out there on this one.
You know it. All right, guys.
That's great.
Anyway, Robin, well, we just spent an hour talking about PR then and now. And in fact, just the fact that I'm hearing your voice and seeing your face, 19 years later, this is a wonderful thing. Friendships like these, they definitely stand the test of time. And you've been through a lot, and we've changed quite a bit, but we're still here. We still have pulses, and we're still fogging mirrors, and we're still fighting the good fight. And when we talked, you said, Andrew, I will do this thing for you because we're friends, but there's something that's really much more meaningful at this point in my life that I'd like to talk about. And I said, Robin, you're my best friend. Go ahead. You can talk about whatever you want to talk about, and I'm going to shut up and let you speak.
I am doing the most meaningful work of my life right now. It's really fantastic. So, one of my, personal goals is to break the stigma around mental health conditions, around mental illness. And a little over 5 years ago, I had a mental health crisis that, completely shifted the earth around me. And, I'm here to tell people that there is absolutely no shame in reaching out for help. I'm here to tell people that I felt worse than I had ever felt in my life. I felt hopeless. All the things that you have read about depression and anxiety, despite having so much in my life, a great husband, a great family, an enviable job, all of those things don't prevent us from burnout and from becoming ill. I did not take care of myself, right? I knew that I had a predisposition to depression. I had a history of a very serious eating disorder. And as a professional, we have to take care of ourselves. So, my mission now is to work to improve the lives of people with mental illness, and in particular, to remove the role that law enforcement plays in response to crises. Let me explain what that means. Right now, if one of our loved ones had a mental health crisis that we couldn't deal with, unless we were very knowledgeable about the crisis response system, the likelihood that we would call 911 is pretty high. And depending on where you live in the country, the chances that a police officer will come to your door is pretty high. Now, I have nothing against the police. They perform a very important duty in our society, but law enforcement are not experts in any level of health. If you had a broken leg, would you call a police officer? If somebody was having a heart attack, you wouldn't call a police officer. So instead of calling 911, what you call now is 988. Have you guys heard about 988? Yep.
Yes.
Right. 988, and this is part of the work that I have been doing, is to spread the word about 988 and to help influence our legislators to ensure that 988 continues. Because right now in the state of Maryland, there is funding through 2025, and then there's kind of this big open, what is going to happen tomorrow? So as the Maryland General Assembly begins in January, my colleagues and I, my mental health colleagues, advocates, and I are going to be working really hard to work on legislation for that and make sure that people get help and not handcuffs.
What can we do to help?
Wow, it's a wonderful. One thing that you can do is to make conversations around mental health and mental illness easy for people to have, to kind of get in touch and like, okay, maybe this is an uncomfortable conversation, and, run towards what's scary to you. Have the conversations with your children. Embrace the people in your life who are struggling and let them know that it's okay and that there are resources available to help them. Many of us have friends and we have family who have had mental health crises in the fact, or they might be dealing with a mental health condition. You can still have those conversations and ask how you're doing, because many of us mask. We don't really say our true feelings, right? In the United States, we say, hi, how are you? And what do we say automatically? I'm fine. Because who is going to unload all of that, right? Sometimes we're not fine. And that's okay. It's okay to take a break from your workplace. It's okay to go tell your boss you're overwhelmed. Are they going to love it? No, they might not love it, but you need to take care of you. So, I would say that's another thing we can do as business owners, as bosses, that we can recognize that our employees are not limited, not unlimited resources, and that they have needs, and people need to be given the time that they need to take care of themselves.
That's a message that a broader audience definitely needs to hear as well. And I'll do what I can to cross promote 988. I had heard about it. I'd seen some friends posting it. So, I mean, the word is getting out there, Rob, and I certainly commend you for doing that. There's a lot of other folks, again, that would appreciate the efforts that you're doing on their behalf.
So, Robin, when someone dials 988,
Yeah.
what happens? Are resources sent to their home, perhaps, like a
You know,
police officer, or
Fortunately,
like the police officers were? We don't want that to happen.
right, we don't want that to happen. So when somebody dials 988, they are connected with a crisis counselor. And I will tell you that before 988, there was another helpline that became 988. And I called that line in feeling as horrible as I did, not understanding my own behavior and being very scared. I didn't even feel like I could tell my husband what was going on. And he is truly my best friend and my biggest supporter. So when I called 988, I'll just tell you, I had somebody who was there to listen to me. They get a lot of training. I know that the person that I was talking to must have had a lot of experience, an incredible amount of empathy. And she helped me figure out, basically, I was in the workplace taking a break, and she helped me figure out basically how I was going to get myself together, tell my supervisor that I needed to leave, get myself home safely, and have a conversation with my husband to ask for help. I mean, she helped me develop concrete steps. I knew that I could call the hotline back at any time and to get that support. Now, we know that in 80 to 90% of cases, people who call 988, they need a higher level of care. And fortunately, in many places, we have what's called a mobile crisis unit or a mobile crisis outreach team. We have 3 right now in Montgomery County. I know in Baltimore City and Baltimore County, you guys are, I mean, the network of mobile crisis teams has been very well established. And what you actually have coming out to your home or wherever you are is our trained mental health professionals who can evaluate you and create a plan. They can take you to a restoration center. They can take you to potentially to a hospital if you need it. And they can provide the empathy that, frankly, a law enforcement officer shouldn't be expected to have. They have other duties to perform. I do want to say that there are a small number of cases when somebody is, actively suicidal. If they're on the phone with 988, there are some rare cases where a rescue does need to be sent. So there is that possibility, but I can tell you from having spoken to supervisors who supervise these hotlines, they make every effort not to have to send somebody unless you want somebody there.
Mm.
So I can't recommend it enough.
Do you know anything about other states? For instance, our corporate headquarters are in Virginia. So as I think presentations, to help our employees, do you know anything about what's going on in Virginia by chance?
Well, I can tell you, so the great thing about 988 is that it's a national number. There was federal legislation introduced and passed, I believe 3 years ago, that made 988 the official number so that it could be just as easy to remember as 911. I mean, that was huge lifting. So this is a national number.
And
it is
national as well. And I'm not
sorry.
The funding is by state, or is that national?
Okay, you raised a great question. So the funding for 988 is supported on a state-by-state basis.
Okay.
Each state is coming up with its own solution. In Maryland, we have, fortunately with the budget that Maryland has had, we've been able to have lump sum support for 988. There may be a different model. There are some models where there is a slight, surcharge on telephones, just like there is for 911. We pay for 911 with our telephone service. So it's possible in some states, Maryland may adopt that at some point. So there's going to be a range of models. I also want to mention that, 988 is just the gateway. It's just the beginning of an entire revamping and renewing of the crisis response system in the United States and in Maryland. What SAMHSA, the Health Human Service Agency, says is that we need somebody to call, right? Somewhere to go. And then we need, ongoing support and services. And so Secretary Becerra, the head of Health and Human Services, who I had an opportunity to meet this summer, is overseeing a team, and under President Biden's vision for dealing with mental health crises is, people are working really hard. Our legislators are working really hard across the aisle. This is a bipartisan effort because they recognize the mental health crisis in our country. And I think that this is while we have so many people, more people than ever suffering, this is a wonderful time for the evolution of mental health care in the US. It's going to be a bumpy road, but I see really great things happening.
That's just amazing. And thanks for sharing, your background and your story as well. It's very touching.
Stories are so important.
Yeah.
One of the very first things I did as a mental health advocate was I participated in something called This Is My Brave. This Is My Brave puts on events all over the country that brings together mental health storytellers sharing their stories.
Wow.
It's such a beautiful thing. All those videos are up. Talk about use of social media. Unbelievable, unbelievably powerful. If you
hearing this, you saying this.
Oh my gosh, so powerful. You, as somebody with a mental health condition who had a hard time talking about it, I could go on to This Is My Brave's website and I could watch videos, and I felt like the people were speaking. They knew the words that were in my head. They knew words that I didn't even know how to give to what I was experiencing. And these are all people who have, they're in recovery and they have seen better things, and they're there to say it's okay to reach out for help.
Yeah, I was sharing with Andrew when we finally met face to face after how many years. Yeah, in our own family, one of my older brothers had died by suicide last September. So, you know, just knowing that there would have been other outlets. He'd had some care in the past, but the masking, the hiding, and it came as a big surprise. So I'm just tearing up thinking about all your hard work, and whatever help you need, just, you know, I think anyone on here would help you.
Yeah. Yeah. I'm so sorry for your loss.
Thank you.
Yeah.
The big one.
Yeah.
Brighter days, and all the hard work you're doing is so much appreciated.
Yeah. I'm very fortunate. You know, I've transitioned full time to doing this work, both with the National Alliance on Mental Illness here in Montgomery County, NAMI. And also there's a racial justice aspect to it. So I work with an organization called Silver Spring Justice Coalition that is specifically looking to reduce violence towards Black and Brown people. And unfortunately, in the last few years in my county here in Montgomery County in Maryland, we have had quite a large number, 5 or 6 Black men in the throes of a mental health crisis who were killed by police. Yeah, so we're working really hard to reduce that.
Well, the world's a better place because you're here. You know, I mean, that's all we can ask of each other. You know, do we leave this a better place we found it? And obviously you're you're legions ahead of the rest, at least ahead of me. So Rob, I'm indebted to what you're doing for our society, as well as, again, your career as a PR professional. You know, you probably fast forwarded my learning by years, you know, graduate level stuff that you gave to us, and just really important. And he told us the important stuff. It wasn't fluff. You know, we weren't wasting time reading slides off PowerPoints. He said, this is what you got to do. This is what you, or more important for Andrew, this is what you don't do, Andrew. That always got me out of trouble too. So
I
mean,
love talking with you. I just it's
likewise,
great, and I'm humbled really by your words. So thank you.
You're welcome. So I'm gonna end this recording,